This, okay. Mr. President, dear colleagues, good afternoon. When you insert a phakic IOL, never forget you or another surgeon will have to remove it and probably to perform a combined surgery, explantation and phaco surgery. Our purpose is to report our experience in this situation. During the last 3 years, I have removed 20 phakic anterior IOL. Most of them were my own surgery. Cause of explantation were cataract, 7 eyes, and endothelial cellulose, especially with the implant from IOLTech and Zeiss Laboratory, New Life. And this is a real nightmare in France, this IOL today, because we have a lot of decompensation. The problem is the surgical strategy, and it depends on quality of IOL, if the IOL is soft or rigid, and the endothelial status. The technique is not always the same. Incision, maybe scleral tunnel is better if there is a high endothelial cellulose. But always I use this coat, and I have no opinion what is the best, microaxial or bimanual. The second question is when to explant phakic IOL. With foldable, there is only one way, small incision, and you explant before phaco. But rigid, you have a large incision. You perform phaco before explantation, and you need this large incision, and you have the risk to have an anterior chamber not stable and iris hernia, but you can perform explantation after phaco, but it's more difficult. We will see in the video next. After, which implants to choose? Monofocal, multifocal, piggyback, I don't know. And for the calculation of the new implant powers, there is no problem if you have a higher master. The first case, this is a foldable IOL, the nightmare of French surgeon. This is a Vivarte IOL or New Life. And to remove, it's very, very easy. You have just to pull on the IOL. And after, you can perform your phaco very easy. Another, this is an artisan, and I choose to perform rhexis under behind the IOL and to disenclavation to remove the IOL, and after to perform phaco. This is a new Vita. There is no endothelial damage, but iris damage, and I perform rhexis behind the IOL. And I decide to perform phaco with the lens because this is a soft nucleus, so there is no problem. I use, because it's eye myopic capsular ring, I enlarge after the incision and I can perform explantation. The last cases, I use tunnel scleral because there is endothelial loss. I perform disenclavation, rhexis under phaco, and always I use this coat. and you can see there is no IOL touch, and I can remove the IOL, and the anterior chamber was very stable during the phaco. Okay. So, in conclusion, when you use phakic IOL, never forget you will have to explant this lens one day. And this day, you don't have standard procedure, but each patient required an adequate strategy. The main point of this surgery is endothelial status. So it is why a strict follow-up of A with phakic anterior chamber IOL is necessary. And don't wait too long before explantation when endothelial risk appears. Thank you for your attention.
Thank you very much for showing us your good technique. We don't like to think about explantation, but we have to face it. It occurs. Just a moment. Are there any questions? Yes, please.
Jean-Michel, congratulations. These eyes are already do have endothelial compromise because they lose more endothelial cells than physiological. Why not using a two-sided incision, namely a sclerocorneal incision, for example, at 12 o'clock, what we did for 15 years ago, which were absolutely closed, no sutures, at 6 millimeter diameter, and then a clear corneal approach from the side, which allows you then to work under controlled conditions.
Yes, I totally agree. You can perform explantation and bimanifold phaco, and you have a stable anterior chamber, but sometimes you can have iris hernia.
Any other question? Yes, please.
I just wanted to ask, how long after the phakic IOL did you have to perform phaco in your case series?
I don't hear.
How long?
How long? It depends the cases.
In your case series, what was the average?
The longest follow-up is 12 years.
Thank you. I would like to make two short announcements. First, the opening ceremony will take place at 5 o'clock in the Victoria Hall, and together with the Alcon Video Awards. And furthermore, there is coffee in the exhibition area, and I would like to thank the audience for staying here and being interested in the topics, and also my co-moderators. As you observed, we took the discussion after each paper because we knew that there were 5 no-show papers, so we had time to that. We could afford that. Thank you very much.